Hi everyone, welcome back to the Kural podcast. And we've got me, Michelle, and you guys want to introduce yourself?
Yeah, so I'm Harry, and we are joined today with Dr. Aimee.
What are you?
If you had to describe yourself to someone that doesn't know you, how would you describe yourself?
To someone who doesn't know me?
Yeah, they don't
Oh,
know you.
that is interesting. Well, oh God, guys, you're putting me on the spot.
I'm just asking who you are.
Okay, so, well, dentist, 5 years qualified, currently working in general practice, with a big love for surgery, oral surgery.
Make it seem so like it's just a 5 years graduated dentist, like it's not a big thing. How are you finding it?
It's good. It's good. I'm really enjoying it. I do love work. No, a lot of dentists do struggle to say that at times, but I think where I am right now in the practice that I am and the team that I've got and the mentor that I've got, I do enjoy getting to work every day. So yeah, it's going really well.
I'm sure you have like days where you're like,
Yeah,
I can't do this
absolutely.
anymore.
Yeah,
What like
yeah.
keeps you going? Like reverts you back to the mindset. Actually, it's like this is a career that I chose that I love. What gets you back on the horse?
I mean, the fact that the reason why I wanted to go into dentistry is what keeps me going, to be honest. So if I go back to why I actually wanted to become a dentist, I had orthodontics when I was a child. I had a really big gap between my two front teeth. I got bullied by my own cousins, which wasn't very nice. And ever since I had my ortho treatment, that going through that whole process and seeing how one's confidence can improve or one's self-esteem can improve by, having their teeth fixed or their smile fixed, that's basically what I wanted to do for other people. So having that experience myself, I was like, okay, no, this is really nice. I want to be able to give other people confidence, give other people, their self-esteem back and be able to make other people smile. So that's essentially why I wanted to become a dentist. And that reason helps me to keep going. I mean, yeah, there's obviously bad days and there's days, there's times where you have breakdowns. There's times where, you have difficult patients, or treatments that you're not so confident with. And yeah, ultimately it's about what you're doing for the patient and what you're doing for other people, and this job is very much serving others. And so yeah, that's what keeps me going.
Have you ever considered going into orthodontics?
Did actually. So actually when I started dentistry, I was very much like, okay, I'm going to go to dental school, I'm going to become an orthodontist. But then when I was in dental school, I did really enjoy ortho. Like I loved all our ortho teaching and everything, but I loved oral surgery more and just, the thrill of extractions or like after you take a tooth out and like that satisfaction that I loved that and just like the challenges of surgery and everything. So I think that's what steered me more to pursue that sort of pathway rather than orthodontics in the end. Yeah.
Okay, so should we go back in time then?
Yeah. Go for it.
What age do you have braces?
12 or 13. Yeah, 12. Something
And
like
then
that. Yeah.
was it around that same time that you considered going to dentistry, or was it a bit later?
A bit later. So, like at school, I knew I was good at science. I knew I was good at maths. So it was either dentistry or going into some sort of finance role. So that's kind of what I had in mind. But I was steering more towards um like the science pathway. And when it came to science, I was like, okay, medicine or dentistry. And it was sort of like having those conversations with other people who were already, doing both, conversations with my parents, and basically deciding that with dentistry, you can have a more balanced lifestyle. And I valued that a lot as well. We can, pick and choose how many days we want to work. We can just do 9 to 5s, and have the evenings to chill and do other things and have the weekends off. And I really like that sort of kind of balance as well. So, yeah, that's ultimately well, I did, work experience and all of that is ultimately what led me to choose dentistry in the end. Yeah.
And then what kind of thinking process did you have when you were applying for dental school? So like the whole personal statement. Did you have anyone to guide you through that, or? were you the first
Going
one?
back,
Yeah.
gosh, this was 10 years ago when I started dental school. So
Things have changed a lot.
personal statement wise, yeah, I did have a few people who helped me. So when I was doing GCSEs and A levels, I obviously went to like science tuition or math tuition or whatever. Like a few of the people who were tutoring me, they were actually in dental school. So yeah, a couple of people got help from them. My cousin, she applied for medicine 2 years above me, so she helped me as well. And yeah, my dad helped me a lot. Actually, he's someone who's really good at like writing out, stuff and just making sure everything sounds really well and all of that. So yeah, so I had a few bits of help. And then interviews. Yeah, I think I went to a few sort of interview workshops and stuff. Definitely did. Must have. I know I couldn't have done that by myself. But yeah, ultimately, so I ended up going to King's. And I really liked sort of the MMI interviews that King's had rather than the panel interviews that other universities had, which I found a bit tricky.
But why, like, what made you prefer?
Because it's like shorter, it's like 5 minutes per station. You see a different person each time. And like, if you didn't do so well, maybe in one station, you can just sort of forget that, move on to the next. And it's a whole different person that you're talking to. Whereas if it's in a panel interview, you're literally talking to the same person for about 20, 30 minutes or whatever. And if you like screw up one bit, you're like, oh God, what are they thinking? And then like that sort of just messes up your mindset for the rest of it. So yeah, no, I found that pretty good.
And then, like, so like you said, it's been 10 years since you started dental school. So, like, what did your, if you can remember that far, what was your perception of dentistry and the like public dental health back then compared to what it is now when you're like 5 years deep into actually being like a general
Gosh,
dentist?
back then, I mean, I had no clue, like myself. Obviously, like going through orthodontic treatment and getting, advice from the orthodontist. And I regularly went to see the dentist. So I was pretty good, keeping my teeth nice and clean. Like my mum would always make sure, brush your teeth before bed. It was like, I always was brought up that way. But like flossing or spit and don't rinse, all of that, I had no clue until I went to dental school. And obviously, going into dental school and seeing patients, especially in areas where where like Denmark Hill, where King's is, you see a whole variety of patients who have no idea actually on how to, maintain their oral health, like whatsoever. There's, I even see patients now who, there's some people who don't even brush their teeth at all. And in this day and age, you would think, that's just basic. That's just basic life. There's still a lot of people who have, sort of no knowledge on dental health. And yeah, I think it's so important, people who are becoming dentists now, who are, we need to implement that and make sure like people understand. And
So, what was your most favorite like part or year of dental school?
fourth year.
Fourth year.
Is that your elective year?
Yes, elective year. And we literally only had one exam that year, and it was a communication OSCE right at the end of the year. So we literally just, yeah, it was great. Yeah, just chilling. Yeah, it was a good year. Went on loads of holidays that year. It was my elective year.
Where did
We went to Vietnam.
Wow, okay. Tell us about your elective.
Oh God, there's nothing much to tell.
Really?
Because so me and my mates, we literally went to Vietnam, took out 3 weeks. 2 days of those 3 weeks we spent, just chilling at a dental practice, got it all signed off, and then went traveling for the rest of the time. So it wasn't really much of an elective. Could have
Still
done
counts. You
something
got
a
it
bit
signed off.
better, but
Good. Sidetrack.
yeah.
Where in Vietnam were you based?
We actually went all around. So we went to Ho Chi Minh first. So that's where the dental practice was. So we were there for like 2, 3 days. And then we traveled all the way up. So this was a while ago now. What was there? Da Nang, Hanoi, Hoi An. We literally traveled all the way up to the north. And then, yeah. Stayed there for about 3 weeks and came back. Really good. Yeah, good fun.
Have you been back since or not yet?
I haven't actually. My parents have wanted to go, so yeah, we might do a trip there soon, one time. We'll see.
So what did the curriculum look like back then? Like, was it oral med in fourth year or
It was a lot of radiology,
right?
oral med, yes. I'm trying to remember. I know third year was like human diseases. Second year was anatomy. Yeah, I would say a lot of oral med and radiology in fourth year. Um, and a lot on communication. That's why we had our communication OSCE as well. So yeah.
For someone who's in like, I don't know, say third year like myself,
Yeah.
what tips do you have for someone in the middle of dental school?
Gosh, I remember having a breakdown in third year.
That's not a good
We
sign.
had so many exams. I was not on top of it during third year. I feel like first year and second year were fine, and then third year when it sort of got a bit, we were doing loads of clinical work. There were loads of lectures, so I felt kind of overwhelmed at that stage. You do get a lot of support, especially if you've got really good friends, clinical partners, and everything. So yeah, I would just say keep on top of your lectures.
Probably that's probably something I
don't
should
don't
do.
don't leave everything to the last minute. You know, third year is where we started to do more clinical work. So, things can seem a bit daunting, but everyone's in the same boat. And you've got everyone around you all in the same boat. So just ask loads of questions. That's probably something that I was quite nervous to do at that stage. Ask loads of questions. Your clinical supervisors are there for a reason. I feel like, the less you know, the more you feel overwhelmed and the more you feel, worried about what you're doing. So yeah, definitely just learn.
And this question is, I guess, for both of you, because you're both like actual dentists, not students anymore. So, what would I be surprised about as soon as I graduate and actually start working as a dentist?
You learn in dental school is like you don't use like 30% of what you've learned, to be honest.
So, I'm just revising all this content, learning all this content. That's fine. Leaves
Oh
that to the
God.
side.
I mean, you might have to pull it out here and there, like in a
Yeah, here and there, like even like all the like oral, well, like oral med, you hardly see any of that in in real life. Yeah.
if you were to see something.
You you
I've
need
got
to know
to,
what it is. Yeah, 100%. Like, you need to know what it is. Like, yeah, you're gonna refer it at the end of the day, but you still need to be able to know what it is so that you can refer appropriately. If it's cancer,
okay.
you need to make sure it's on the 2-week wait. And if you don't know that it's cancer, then, you're kinda screwed.
Yeah,
So,
otherwise I'm just going to look at some like big board. I'm like, that's fine. Leave
yeah,
it. And then,
like, what's this little blob doing? But yeah, I mean, a lot of it, like oral med was really interesting during uni, but I found it even more interesting when I was doing DCT because you actually see it a lot more and you really get to understand like the pathology and, the treatment for everything.
do you think,
I was gonna say another one is like communication, because I know they bang on about it in dental school.
Yeah.
You've got a supportive environment where you've got like your clinical supervisor who'd probably come and say the same thing that you said to your patient. But like
Yeah.
when you're out in practice, it's just you and your patient, and like it's your reputation on the line, not like the dentist
Mhm.
or anyone else. And then like there's the whole again what we were talking about before. It is patient manager. I think okay, I might be completely wrong, but based on my experience, I think a large chunk of dentistry in practice is patient management.
Mhm.
A lot of them don't know what you're actually doing in their mouth, and some of them aren't even bothered. They're more concerned about, do I like this dentist? Do I trust this dentist?
Yeah, 100% agree. Yeah, like you see a patient, and you go through like an extensive treatment plan with them. And then the next time, and then, like you tell them, okay, next time we're doing this filling. They come in, and you're like, okay, do you remember what we're doing today? And they're like, no idea. It's just like no clue. But they're there because they trust you, and it's ultimately that. it's literally all about communication, how you manage the patient, like you said. It's all about building the trust, building that rapport with patients. And if they like you, they'll come and see you again. If they don't like you, they'll go see someone else.
How would you like start off building that trust in the first place?
Good question. I mean, it's just having a chat. Just see them as, a normal human being that you're just getting to know. So yeah, just they walk through the door. You don't want to, be like, okay, sit in the chair, open your mouth. That's not what you want to do. You want to, talk to them like a normal human being. Really get to know them, where they're from, what they like, what their hobbies are, and be genuinely interested in their life and in what they have to say as well. And it also helps for you to open up to them as well about your life as well, and just be a normal human being. And they need to see that in you for them to trust you, because dentistry is a big thing, and a lot of patients are really anxious about dentists. We've not really had a good rep over the years, so people are genuinely really scared. So yeah, it's just about building that trust and just being a really nice person, being really kind. Yeah.
Also, I think maybe maybe this is a bit of a hot take. I feel like dental school sometimes doesn't allow you to build that trust, because at the end of the day, you've got so many quotas, so many like restorations to do, RCTs to do, this to do. So at the end of the day, you're gonna start seeing your patients as numbers. Okay, yeah, I want this patient, not because I've had them before, because I just need to make sure I tick this off. So do you
Yeah.
think there's a way around that, or do you think that's just part of and parcel of?
No, you're absolutely right, because in dental school, like you said, it's all about quotas. Your mindset is literally like, okay, I need to see this patient for a filling. I need to see this patient for a denture. You're not thinking about spending that time talking to them. You're concentrating on your actual, work, and you ticking off your numbers and everything. Yeah, but I mean, I would say do try and spend that time, because ultimately that's what it's down to. When you come to working in real life practice, communication is key. And if you've not sort of learned that, which we don't really get taught that in dental school as much. We spend like, a few days on it. We had one exam on it, but it wasn't really emphasized as much, I would say. So, if you can try and work on it as a dental student, then that would be amazing, because it will, help you when you come to working as a full-time dentist.
Is there like a particular experience where you've tried your best, like trying to build trust with the patient, but
Mhm.
it hasn't panned out?
Mm.
Is there a particular experience that comes to mind?
Yeah, I mean, there definitely has been. I can't think of a particular one, but each person is different. Each personality is different, and trying to understand people's personalities, you'll only really try and understand once you see more and more patients come through the door. There's some people who, they're not anxious. They just want to come in, get their checkup done, you know, know what they need doing, and then just sort of walk out the door, come back next time. They don't want to be spending time talking to you, sitting there, being all emotional or whatever. But there are some people, on the other hand, who do need you to kind of like be their therapist almost. Who do need you to just, sit with them and talk to them about their life problems and spend that time with them. So it's just, yeah, it's just about trying to understand each person. It can be quite tricky. I think in university we did kind of go through like personality, sort of different personalities, and going on sort of dental communication courses can help as well, to help you to sort of understand who's walking through your door. Yeah.
So you mentioned that you did DCT. So Michelle, you're also doing DCT.
Mhm.
Is there like,
Yeah.
is it something that everyone
It's
should do, or is it more like, you know what, if you want to specialize, then do it?
Okay, so it's not something. Okay, maybe I'm biased, but it is definitely something. Even if you want to go just back into general dentistry, it's definitely an experience, and you're not losing much out of it. And honestly, like if people are like, no, but I'll be earning so much more as a general dentist instead of doing DCT, like that's not true. Like we do get paid quite well as DCTs. I'm not going to lie, but the experience that you're getting is invaluable. Like, you can pay as much as you want for a course to supplement that, but you're not gonna have the same experience being in a hospital, being involved in such a big team that deal with very complex cases. I don't think that's something you can easily get. And it's
Mm.
only like it's not like you have to commit to, like, the 3 years or the 2 years. You can literally just do a year, and that's something that would boost up your CV. That's something that you can get connections from. So I think you're never losing out doing a DCT. What do you think, Amy?
Yeah, I 100% agree with you. Like I feel like DCT has to be compulsory. Like you do uni, then you do DFT and then DCT, at least 1 year of DCT. Because like you said, the experience that you gain it's absolutely invaluable. Like if I went from, foundation years straight into practice, I wouldn't be like confident with taking out teeth or, I will be like really scared about perforating an RCT or something. Like that used to freak me out. But now like going into DCT and seeing,
The bigger picture.
the bigger picture, yeah, you're working as part of a bigger team, treating patients with cancer and, fractured, jaws or whatever. It's insane, like the amount of stuff you see. And, no sort of oral surgery course is going to give you the amount of experience that you learn in DCT. You spend a lot of time, really like learning how to take out teeth or learning how to suture or all these skills which you do need in day to day dentistry. And it just gives you that confidence to do it all. Communication as well, communicating with patients in hospital who are going through, a lot more sort of severe sort of health issues. Learning how to communicate with those kind of people will really help you communicate in dental practice. Yeah, there's just so much that you can learn. So I would say like everyone should do it, whether or not you're thinking about specializing. It's definitely a great experience.
And it doesn't have to be max facts either.
Absolutely, yeah. It could
Would
be
you recommend Max
community. It
Facts?
could be. I would, yeah, yeah. I
'Cause you can't
enjoyed
do
it.
it
I
afterwards,
loved it.
right?
Say that again.
You can't do it afterwards, like, 'cause you
You can.
gotta do me
You
but is it
can, you can. I'm pretty sure you can. You
okay.
don't have, yeah. You don't have to go straight into, DFT, DCT. I'm sure you can, yeah, take a
Several
Yeah,
break.
but
people
it's
I know that have, like, gone into practice for a good, like, couple of years, 2, 3 years, they've realized, like, "No, this is not it for me," and then they go
Mhm.
the obesity route. So it's never, like, too late as
mhm,
well.
Yeah.
yeah. So it's like you always have the option to just do DCT whenever you want. But in terms of, like, Max Facts, you can't do it outside of DCT, right? Because you would need a medical degree.
As, like, you were yeah, as in, like, you would need to be, under the GMC cover to do
Okay,
Max Facts.
Yeah.
right. And then would you recommend doing it's up to 3 years, right?
Yeah.
Would you recommend doing all 3 or just, like, at least just do 1?
It depends what you want to do. Like for me, well, I thought I wanted to specialize in oral surgery. That's essentially why I ended up doing DCT 1. And then after DCT 1, I was like, okay, I don't know if I actually want to specialize, or if I want to go back to practice, and, be able to do more specialized treatment, but not be a specialist. So I ended up doing DCT2 because I was like, okay, at least if I do DCT2, then still got the option of going down the specialist route. But yeah, ultimately, I didn't decide to specialize in the end, but it still, really helped. So I didn't end up doing DCT3 afterwards, just the 2 years, and then went into general practice after that.
What put you off, specialising? Was it just that you realised you just much prefer general dentistry?
I wanted to do a variety of treatment. So, in general practice, I can still do my fillings and root canals while still doing my, extractions or implant work. So I kind of wanted to do a mix of everything. So that's ultimately why I didn't want to just specialize in one avenue.
So is that a necessity to have publications, to have case
Yeah.
report, that kind of stuff?
Yeah.
Okay.
Yeah. And I feel like if you're someone who already kind of knows, being a dental student, and you already kind of know that, okay, maybe I want to specialize, then it's worth starting those publications or case reports whilst you're a dental student as well, because that that can potentially help you with applying for specialist training later.
Okay. Is it competitive when you're applying to specialist training?
Yeah, I think so. Yeah, I don't think there's very many, like, if, for example, in oral surgery, I don't think there's very many jobs available in a year. Probably like
Yeah.
9 or 10
Oh
spots.
wow.
Yeah.
So when you're applying to DCT, there's no competition, but as
Mm,
in when you're
there's a lot of competition for
there is
DC.
competition, but
Yeah, there is.
There definitely is.
Yeah, not everyone gets a DCT role, or not everyone gets a role that they've ranked at the top. So yeah, you do have. I don't know if there's still DCT interviews.
There is. So
There are, yeah,
yeah, SAT, and then the interviews,
and
and
the interviews, yeah.
quite a lot of people around me didn't get DCT spot. I've heard. I don't know if this is true, but I think it's getting more and more popular. Apparently, DCT, because I think
Mm.
people are clocking that paying for all these extra courses whilst working as a general dentist is actually not cost effective. So yeah, the competition ratio is a lot more higher now.
Yeah.
Yeah,
so what would be the advice to try and get to the cream of the crop?
just go and do DCT. What I would say. And the thing is, like, interview as well, like they ask you clinical scenarios, but this is something you build over time. You build knowledge throughout your fourth year, fifth year, foundation, especially foundation year. That's when you get your hands dirty in actual practice as well. But you'll be fine.
Actually, to get past dental school, that's my big hurdle. I'm thinking like years ahead.
Yeah.
If you get through dental school, you can do anything else.
I need to handle my one patient on Thursday mornings first.
Restorative, like, is it your own restorative clinic, or like? So do you not
Yeah.
do ped clinics?
Yeah, so we have peds clinics, but not yet. That's later down in the year. So this is just resto
Okay.
clinic. So it's just
Fine.
literally just resto and perio. That's it, really.
Yeah, I think that's pretty much what we did in the third year as well. Restorative perio and like
A bit of
dentures and
ros,
whatnot.
yeah.
Yeah.
If you're enjoying this episode right now and you find it really helpful, it would mean the world to us if you could just follow or subscribe wherever you're listening and share it with someone that you think that this would be really, really helpful for. That way we can bring on more and more guests and share more of our stories. Anyway, let's get back to the guest.
Wow.
Yeah. So actually, I had this question. So you think that everyone should do DCT? Do you think there's anyone that shouldn't do DCT? Like they should probably avoid it. It's not for them.
So I think everyone should.
Yeah, I generally think.
Why wouldn't you? You're learning so much in hospital. Like, you're learning all these invaluable skills. I feel like if I didn't go into DCT, I would be kind of lost in general practice. Like, especially like with like the confidence that you get, with talking to people and talking to patients about treatment options and actually, doing those treatments as well. Yeah, you get all of that in hospital. So why wouldn't you do it? People who might be scared of blood or whatever, because everyone thinks, oh my God, Max Fax. You're seeing so much blood, it's all gory surgery. Yeah, and yes, it is, it definitely is. But when you put yourself in there, challenge yourself. It's really important that people do challenge themselves. If you're not comfortable with something, get out of your comfort zone, go do it. That's the only way you're going to grow and develop yourself personally as well.
Yeah, and I guess especially if you've seen all these big cases. Because I remember when you came for your talk, you talked about a patient that came in with a massive cut down his head, right?
Yeah. That was my
Once you've seen,
first ever laceration, and first day being on call on the weekend. So, and weekend means you're literally there by yourself. I actually do remember that case because it was my first laceration. You don't ever forget your first one. And the fact that I was there by myself, and yes, I felt really sort of queasy just looking at it. But then, you have to then sort of calm yourself down because you're the only one there. You're the only one there who can help this patient. I mean, yeah, you can call your registrar, but it's a weekend, they're not next to you. They're somewhere else, they might be at home or whatever. The consultant's definitely not there to help you. So you're there by yourself and you just got to be brave. You just got to do it. Yeah.
I guess that after you see something like that and you've handled that situation, guess going into dental, like general dentistry, it's just be like, it's like a walk in the park, right?
Yeah, it's like, yeah.
So it's that invaluable experience.
Oh, yeah, definitely, definitely. Yeah. How do I say it? It's like you see something like so big like that, and when it comes to like caries removal and oh my god, you've exposed the pulp or whatever. That's in dental school. That's like, oh my god, that's the end of the world.
Yeah.
But when it comes to real life, that's so minor compared to all of.
I think that's what feeds into like what I was saying about when you step out of dental school, you realize what the true world of dentistry is. It's not like, oh, have I got the angle of this right? And have I got the
Yeah.
sharp point off? And like, yeah, okay, it's not the best work if you haven't got those correct, but
Yeah,
actually the end of the world. No.
yeah,
Yeah.
it's not.
And
Yeah.
like, for example, like I think when I was in practice and I would see someone with like a swelling, like I would be like, oh my god, right, this Amy.
Mm,
Like you would start panicking because you're not used to seeing that in dental school, but it's very
yeah.
much it's quite common to see that in practice.
Mm,
Amy, would you say you agree? Like because we've seen like incision drainage under
mm,
gen- we've seen kind of like what the worst situation can be, lung
yeah.
and angina, even like air.
Yeah.
We've seen the real worst of it. So it's like when you go back into practice, you're kind of like, oh, okay, fine. Like I know how
Yeah.
to the situation without it getting dangerous,
Yeah,
essentially.
absolutely. Absolutely. And yeah, like you said, dental abscesses, like you deal with that a lot in DCT and you really learn how to manage them. So, like going back into practice, you see someone come in with a dental abscess. You don't need to, send them off to hospital, obviously, unless it's quite serious, but you can just drain it yourself in practice, get it numb, pick up a scalpel, drain it yourself in practice. And that saves the patient all that time and energy to go to the hospital. You can just do it yourself because you've got the experience to do it. It's something quite simple like that. You can. Yeah.
And also, you mentioned that some people might not want to do DCT because they don't get that pay increase as because they're gonna keep the same pay as your foundation. If I'm thinking right, isn't it?
No, so it depends. So if you're doing nights and on calls, you do
Yeah.
get a higher pay.
Right.
So for my DCT one, I did nights and on calls, so I got a higher pay then. DCT two, I didn't do any nights and on calls. That was in Oxford, so the pay was actually a bit lower then. But yeah, I mean, it's. I feel like being so young in our careers and just stepping out of dental school. Personally, I don't think that we should be so worried about pay at such a young part of our career. We need to be more sort of concerned about, am I getting the right experience for helping me to develop myself and helping me to grow? Because that's ultimately what it is. Because I feel like if you go straight into dental practice, you sort of get comfortable in that setting and you don't, then you feel worried about going back to DCT or back into hospital, back into sort of a teaching environment. Whereas if you sort of go straight from uni, DFT, DCT, you're already sort of on that path, on that sort of under supervision. You're learning, a lot. You're getting all that experience from all these consultants or registrars or specialists. And I think that's so important. Being so young in our careers, we just have to get all that exposure from people who have experienced it all and pick people's brains, just really learn. You don't learn everything in dental school, you really don't. So if you've got the opportunity to learn through DCT, then I would say take it.
So you think it's more of like a continuation from university instead of
Yeah,
like
yeah.
just extra experiences, more of like, okay, this is like the step by step to become the best dentist you can be.
Yeah, definitely.
Okay.
And, like there are definitely courses out there that you can do whilst in general practice, but these courses are not, they're only a few days here and there. It's not sort of continuation of your learning. And yeah, I feel like how would I say it? It's like whereas in your when you're in hospital, like you go, like you've got like an extraction clinic or whatever, you've got a max fax patient that you're following up on, you're learning more. Whereas in general practice, I feel like you can sort of become focused on doing your work and not really thinking about okay, you need to learn more or you you probably don't really understand what more you can learn potentially.
So you think that if you went straight into general dentistry, would it be like not lazy, but it's like you're not building yourself. You're getting comfortable in your role, and you're not like pushing yourself as hard as you could be.
Yeah, I mean, it depends kind of what you want to do as well at the end of the day. If it comes to surgery, then I would say definitely, DCT is so important for it. If you're not keen on surgery, if you want to become, maybe, do more aesthetics or cosmetic work or restorative work, yeah, I mean, I don't have any experience in restorative DCT job, but I'm pretty sure that will help as well. So, and I know there are really good courses, for um, aesthetic work or restorative work, diplomas, PG certs out there. So, yeah, it really depends what you want to pursue. But I think DCT will really help sort of get that overall picture, that overall sort of understanding of dentistry and what's really out there.
Aimee, you said that you did nights. What was your most memorable night?
All of them.
Um, yeah, they all kind of.
Yeah. Or a very interesting case that you saw that still kind of stands out to this day?
Loads.
Is there one where like you might see a patient now, and you're like, oh, you know what? I'm glad I had the experience with that patient.
I'd say, like dental trauma. You see a lot of that. I'm not talking about mandible fractures, more sort of things that you can see in general practice as well, like luxation injuries or, um, avulsions, all of that sort of thing. So we saw a lot of that when I was in Portsmouth, especially during nights, because Portsmouth is it's a notorious place for people getting into fights. Yeah, people getting punched in the face, their teeth knocked out. You need to sort of remanipulate it, splint it. And that can be quite tricky when you're alone on a night shift. Especially like, you're trying to do everything. You're trying to like suction, you're trying to hold the teeth in place, you're trying to put the splint wire across, you're trying to cure the composite. It can be really tricky. But yeah, you kind of sort of learn how to do it and get into the flow of things. But yeah, I would say the trickiest part of being on call is the number of bleeps that you get. It's insane. You're in the middle of trying to, like, for example, splint someone's teeth together, and suddenly, you get bleeped and bleeped and bleeped and bleeped, and it's just crazy because I feel like you can't. You need to like stop, answer the call, find out what's coming through the door next, and then you're thinking about that whilst you're treating this patient. So it's yeah.
How do you guys recover from nights? Because it sounds dramatic.
I mean, they usually give I don't know how. Which hospital are you in, by the way, Aimee, for your first year?
Yeah, no. So at DCT1, I was in Portsmouth at Queen Alexandra. And then DCT2, I worked in Oxford at John Radcliffe.
Okay,
Yeah.
right. And then how did you recover from nights, or how did you prep for nights? Actually,
I mean, yeah, definitely try and sleep before your night shift. So if night shift started at 8 p.m., I would, try and get a few hours sleep, about 3-4 hours sleep before that. I would have my dinner and then go to night shift. And then, yeah, I mean, you don't get bleep sort of, straight away. Sometimes you do, but, you've got time to chill here and there. Try and eat when you can. Do take, I used to take some food in with me during my night shift. So I was, fueled up. Because sometimes you get, you might not be doing anything for like a couple of hours, and then suddenly you get called at like 3 a.m., which can be quite crazy. So yeah, I always used to take some food in, take my laptop with me, watch some Netflix if I did have a bit of free time to free my mind,
Yeah.
and then get bleeped, and then you're suddenly like, oh, I need to go down to A&E now. Yeah.
How did that affect your like relationships, like just working nights? Because whilst you're on like a complete different clock to everyone else, right?
Yeah. What do you mean?
As in like, so like your friends, you can't really meet up with them during the day because you're sleeping,
Right.
stuff like that.
Yeah. Yeah, I mean, yeah, that's the thing. So yeah, your social life, you kind of gotta just figure out how to balance it. Yeah, it's out the window. Yeah, no, there was a lot of stuff that I did miss, because I was doing nights and on calls. I was on call New Year's weekend when I was doing DCT. So like I missed all of that. I missed, being with my family, being with my friends, and like my husband now. That I met him just before I moved to Portsmouth. So like, sort of, yeah, that was quite difficult. But you learn to manage through it, and I feel like so it's my social life and family life is something I really really value, and so that's kind of what brought me back into just being more sort of a routine dentist rather than pursuing max fax, because I really did enjoy max fax. So I definitely enjoyed it 100%. And at one point I did think, okay, yeah, I do want to do max fax, but it meant, going back to uni, doing medicine, being F1, F2 doctor and all of this and that, doing, nights and on calls for the rest of your life. And for me, I was like, no, I don't think I can do that. I think 1 year of that was enough for me. So yeah.
I do
How do
have a
you
support
feel, Misha? Sorry. How do you feel about your nights and on calls, Misha?
Do mine a bit differently. Okay, so
Yeah.
I'm not saying I've got the best routine, but usually
Yeah.
on my first night shift, I don't sleep for 24 hours. So,
Okay.
so I usually just wake up normal time, kind of do what I need to do throughout the day, go for my night shift. And then, I don't know, psychologically, I kind of build up like a sleep deprivation bank. So we usually have like 4 night shifts in a row.
Yeah.
Again, like Aintree, because it's one of the main hospitals in the Northwest. So all the referrals get bounced into Aintree. So, and we do a lot of flaps, like a lot of flaps,
Mm.
at least one a day or something like that.
Mm.
So we have to, the DCT have to do flap obs every 2 hours
Yeah.
minimum. So I'm not trying to say that we've got it harder than everyone else, but we are constantly bleeped and we don't really have
Mm.
to sit down. Like there'll be nights and days where like it's kind of normal for us not to eat. I'm not trying to advocate for that, but it happens.
Yeah.
I don't think
Yeah.
people realize how busy it is.
Wow. Yeah.
And like how you're working is, I was working the Christmas shift on call,
Yeah.
and like you'd think people would stay at home because it's Christmas,
Yeah.
like spend time with family, blah blah blah. But we'd have like, I think Christmas Day we had like a neck stabbing come in, and I was one on call. So my reg/consultant, they weren't in the hospital. So again,
Yeah.
it's like putting yourself in that uncomfortable situation.
Yeah.
Like I don't know 100% what to do, but you just have to go and get on with it.
You just got to do it.
Just have to
Yeah.
force yourself.
Yeah.
Like you're not alone. Like you are with a large team, but you do represent kind of head and neck.
Yeah.
So sorry, I was steering away from the question. But yeah, prep for nights. I don't really prep for nights. I do it in kind of a way. I did try like having dinner before and blah blah blah, but it didn't work out for me. And then like
Yeah.
recovering from nights afterwards, you kind of have to force yourself to kind of switch back into like
Mm.
routine. I don't know.
Yeah. I would just come back from a night shift, shower, and then just literally just sleep.
Yeah,
And then, yeah, you kind of just, yeah, your body kind of just gets
gets in
used to
that routine.
it. Yeah, it gets into that sort of cycle somehow.
Yeah.
And yeah, yeah.
I'm really selling me on DCT right now.
This is another thing. Not all DCT posts you do on calls and nights.
Oh, yeah, yeah,
Okay.
you don't. Yeah. So, like for me, for Portsmouth, I did nights and on calls, and that was just dentists doing, sort of being in the whole Max Fax unit. There were no like F1 or F2 doctors working in Max Fax. So, we were the SHOs. In Oxford, it was dentists and doctors working together. That was a lot more sort of chilled, I would say, in Oxford, because you've got a bigger team of people. There's more of you on call. There's more of you to share out the jobs and look after the patients on the ward. So that was a bit more chilled. And there was no nights for the dentists. There was only daytime on call.
So when like you're on nights and it's
Mm,
just you, where do
mm,
you have like a support system where you can just like go and like vent or like just talk to someone about like, because obviously it's like a really high stress environment, right? And only a
yeah.
few people can actually understand what you go through. So who do you speak to? How do you keep sane?
A couple of my uni friends were doing DCT at the same time, not in the same hospital as me, different hospitals, but I remember, I would, text them, call them. Or I used to live with a couple of the people that I worked with, so a couple of my friends in DCT. We all lived together. There was four of us. So we had, a group chat. We all just message each other, or go back home after a bad shift or whatever. Like my friends are there to talk to. You definitely need a support system when you're doing this kind of role. You can't, do it alone. You definitely need to, and be develop a good relationship with your registrar, with your consultant as well, to be able to, be confident to message them, talk to them as well if you've got a difficult case, because the last thing you want to do is, mess something up because you don't know what you're doing. So, yeah, definitely, speak to your registrar, speak to your consultant, make friends. Yeah, it's so important.
So like usually when I hear about night shifts, I always hear about doctors doing it. I never really
Mm.
hear about dentists doing it. So it's quite interesting to me because they never really talk about it in dental school either. It's just because they just teach it to you as if it's general dentistry, right?
Yeah.
As if you're just gonna be like a normal dentist. All of this is like new to me, completely new to me. So I was wondering,
Yeah.
like, have you guys ever seen the show, or you might have read the book? This
This
is
is
gonna
gonna
hurt.
hurt.
Yeah.
Is
It
that?
literally just
Yeah.
reminds me, yeah.
Yeah. I've read the book. And I've been to his show actually. What's his name? Is it
And
Adam?
Adam McKay.
Adam McKay, right? Yeah. I've been to like one of his live shows where he literally like talks through everything that he's written in the book. And it's kind of
Yeah,
like a musical. He's got like a little piano with him and he's like playing the song, but like telling us the story while singing the song at the same time. It was very weird. It was quite cool.
yeah. So like, does it ever? I assume it would probably be as stressful like that. Um, but then, are you happy that you are actually a dentist and not on the doctor side, or are you a bit indifferent
Yeah.
to? Are you happy that you went that route?
I am because of like I mean for each person's different. Like I said, I really value like my time with my friends, my family. I feel like I'm just thinking about like my cousins who are doctors and they need to, think about their night shifts, their on call weekends. They need to really plan out their social life. They need to think about, oh my God, I can't take this annual leave, or I need to swap this shift with someone else, or um, and that kind of stuff. I'm quite happy that I'm a dentist and that I can manage that much better in my life, because work-life balance is so important. I know there's some people out there who will just love to work, constantly work, but yeah, each person's different. And yeah, I just think mentally as well, I think it's quite important to really have a good balance, whether you're a doctor or whether you're a dentist, doesn't matter. um but yeah, just finding that I feel like being a dentist gives me that time to be able to do other things that I really enjoy as well. um yeah, just being in tune like with my hobbies, or yeah, no, I'm not saying that doctors can't do that. Yes, they can, they definitely can. But I feel like it might be a bit harder for them because of their lifestyle.
Mm. So, what kind of hobbies are you into that kind of get like de-stresses you from day's work? Netflix.
Nah, I mean Netflix, yeah. Yeah, me and my husband, we love to watch a lot of like crime thrillers.
Mm. There's a new one out actually. I started watching it.
Which one's that?
His and Hers.
His and Hers. Yes, I've seen that all over Instagram. Everyone's been sort
Okay.
of commenting about it. So that's on my watch list.
Mm.
I don't know if you've heard of Harlan Coben.
His new one. Yeah.
His new one's come out, but I haven't watched that one yet, but I've
Okay.
watched all the others. They're really good. And so yeah, I do spend time watching some Netflix shows. But other than that, I play the piano, so I love doing that in my spare time. I love to dance. I used to dance a lot at uni, which I kind of sort of left behind after I finished uni, started working. But now I'm trying to get back into it, going to dance workshops and classes and stuff. Exercise helps, although I haven't been to the gym in a little while, but it helps.
Yeah, because I feel like that's something that I feel what happens to me. I know I'm only a little dental student, nothing like compared to like a really busy dentist, but it does sometimes like what happened in your third year. It does catch up to you sometimes.
Mm,
So sometimes I'm struggling. I don't actually have time for hobbies at this point, you know. But I think just anything just to get your mind off it really does help.
yeah.
I think I was mentioning earlier, I tutor on the side. First of all, started off as a hobby, but now it's got to a
Mm,
point where, like, if I don't do it, it's literally like my second job. Like, if I don't do it, I actually like, um, I can't pay for my uni basically. So, um,
yeah.
that hobbies turned into something that's no longer a hobby. That's quite difficult. But I think there's some stuff where you just gotta have it try and be completely separate.
Mm,
So, like you said, dancing, like, there's no way dancing is gonna come in the way of your dentistry. And
yeah.
is there any you would wanna get into, but you feel like something's gonna be sacrificed, so you don't have time for that yet?
Mm. I mean, that would not necessarily actually. I think, yeah. I mean, it's the kind of stuff that I'm trying to do now. I'm trying to make more of an effort now to really, do other things that I enjoy and other things that I love, like the dance classes or the, piano or whatever. I think I like it is one of my like New Year's goals to just make sure that I really do make time for other things and not just be thinking about teeth all the time. Because that's just going to drain you. Work is work. You still got a life to live and do other things that you enjoy. Yeah, like I said, it's really important mentally as well, just to get your mind off work and not be, talking about it or thinking about it all the time because that can really stress you out.
I think, like, I don't know. So I went to University of Sheffield, but I can't speak for all unis. I don't think there was much honest, open talk about how our careers have got like one of the highest suicide rates and
Mm.
one of the highest rates of depression. And they don't really teach you how to manage it. It's something you kind of learn along the way in dental school. And then I think over the past years, working and going to conferences and talks and blah, 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 um, you meet people. I think I met this dentist whose son actually passed away from suicide. And then he kind
Mm.
of got um, more involved in like the whole suicide prevention society. But there is always help, but it shouldn't get to the point where that's like the last thing. Do you get what I mean?
Mm.
Like, you need
Yeah.
to really learn how to manage stress because at the end of the day,
Mm.
like, most of us go into general dentistry and most of us are in one room with a nurse, and you're dealing with this whole patient flow, patients coming in and out. You're changing your mood depending on the patient's mood.
Mm.
But it's not only managing the patient, you're actually managing like microsurgery essentially in their mouth whilst they're awake, note taking, making sure that there's no kind of legal aspects, legal problems waiting for you. Make sure that you're following guidelines. You're doing the best. So there's so many things to think about. And like, what, this is
Yeah.
an 8-hour shift, and then you come home, right? And then you need to learn how to kind of deflate from that and also take care of yourself.
Mm.
So it's not, and I get it in third year. Third year is really intense. So like for us, we had a lot of clinics going on, as well as what do you guys call it? Medical, like basically our medical unit, like the human body. So so I wouldn't downplay it as like, oh, I'm just like a dental student, blah blah blah. Like, it is intense.
Yeah, it is.
Like,
Yeah,
it's
definitely.
a jump you're not used to. But as you get older, you get a lot of those jumps. You kind of get tired. Do you know what I mean? You're just like, oh, like, it's like another thing I need to get used to now. But
Yeah.
make sure you take care of yourself.
Yeah.
How do you
It's the
deflate, Michelle?
stress management is definitely so important. Like you said, Michelle, like I feel like going into general practice, I've kind of learned that you've got to be your best for each patient. You're going to see like 20, 30 patients every day. And you kind of like, if one patient makes you upset or if you've got a difficult patient, you kind of need to learn to just switch out of it for the next one. You can't carry on that mood for the next patient that walks through the door because that patient doesn't deserve that. And, and it is difficult. It is really difficult because you're thinking about all these things that are, in your head. You've got all these notes to write. You're running late. Like, you've got this difficult treatment to do. Yeah, it's managing that stress can be really tricky. And especially because you've got to make all the decisions when you're in general practice as well. Um, like, you're the boss of that room. You need to be on it. It can be tricky, and patients can see it in you if you're quite stressed. I actually recently had a patient. I was having a stressful day. She had a broken tooth, wanted it fixed, and I was being sort of really quick with the treatment, quick with doing it, cleaning her tooth, putting in that GIC as a temporary, just really quick with it. And I wasn't really thinking about that. I just wanted to get it quickly done with so I can crack on with everything else. But she picked that up on me and she was like, "Oh, you're being really short today. Like, you seem really stressed out." And she got really stressed out because I was being stressed out. And she sort of just walked out like, she was happy that I fixed her tooth, but she still walked out the door, slammed the door and left. And I was like, oh my God. Wow. Like, I really need to learn to manage my stress because it affects the patients, and then, they can end up, losing their trust in you as well. But it's hard. It's really hard.
How would you build that reset button though between patients? Because
Yeah,
I'd
no,
assume
good
that's quite
question.
difficult.
Yeah. Just breathing, breathe. Make sure you've got a really good nurse. Your nurse will make or break your day. If you've got a nurse who is, like a friend, build that relationship with your nurse. Like, literally, if you need to scream, if you need to just, like, take a moment, you can walk out your surgery and just, get like 2 minutes to just breathe, just talk to someone. It's so important that you just let it out before the next patient comes in. Otherwise, it's just going to all build up and then you'll explode. But yeah, definitely having a nurse there or someone there for you to just talk to and just let out any sort of stress or frustration, it really, really helps. And then you just, like, okay, like, I've spoken about it, I've dealt with it, I'm done, I'm ready for the next.
Because we actually had like we had a peds tutor when I was in clinic. He was talking about how even he's been doing it for God knows how many years, but sometimes he just forgets that this is literally like someone that has come to you with a problem,
Mm.
and you've got to try and just not see them as like a little, like, another inconvenience, adding on to the stress of the day. Because he said that he had to go for a appointment for his son afterwards, and he felt like the doctor wasn't like, they were like stressed. They weren't really, like, they wanted to go home. They just wanted to get out of it, and he didn't feel like he got the best service that he wanted to get, like, for his
Mm.
son. Then he realized, wait, hold on, this is what I've been doing as well. So I guess, and however long you are in your career, that's something that you just got to keep working on.
Yeah.
I think I
Yes.
spoke about this in a previous podcast, but like, I had a tutor the first like intro to clinic I had. He basically said every single day that you go to work, it's kind of like you're ready to play. Like, it's a stage basically.
Yeah. I was literally going to say,
You have to put, like, kind of, you do have to put a mask on in front of everyone, and then like,
yeah.
yeah.
Yeah, like, I've been to a communication course and they were literally like, every time a patient walks through the door, it's showtime. Like, you're literally like putting on an act almost. Like, the previous patient might have stressed you out, but then, like, when the next one comes in, just got to drop it and just be like, "Hi, I'm Amy. How can I help you?" And just, like, be, that bubbly self again. Yeah, you can't just be all moody and be like, "Hey, what do you want?"
So you
Yeah.
spoke
So,
about like courses and stuff, like after dental school.
mm.
They're like particular courses that you think, okay, this is a must for people. Kind of like what DCT, where you think DCT is, right? It should be a must for everyone. Are there any like private courses that you think should be a must for everyone?
Are you
Uh,
sponsored by any courses?
She's got a referral code.
yeah, type in Amy 10 for 10% off.
10% off.
No, I'm not sponsored by any courses. So I've actually started doing a restorative course myself. Because I was, did DCT, all of that. I felt like my confidence in surgery was, is really pretty good. But going back into general practice, I was like, okay, I need to like work more on my restorative skills and doing more sort of aesthetic work and stuff. Um, I think like doing the course that I'm doing right now, it really helps. It builds on what you've learned at uni. Um, and it just, gives you, more skills. Like uni is just basic. Like doing this course made me realize that uni is, literally just all just basic treatment. So yeah, I would say doing a restorative course is really important. I've spoken to a few other dentists as well. Um, who've recommended, definitely do like a PG cert or diploma, a restorative diploma, um, because it helps you to just build on those foundation skills.
Would you need to go back to like uni for that PG cert, or you can just do it all privately?
Yeah, you just do it privately.
Okay,
Yeah, yeah,
right,
yeah,
yeah.
yeah.
Because we in like a previous episode, we had a doctor that she said that she went to Brazil to do like implants and stuff like that.
Oh, okay,
So,
yeah.
do you think that's a good idea to try exploring that worldwide, not just in the UK? Like, it could be restricted by certain things.
Yeah, I mean, yeah, definitely. I mean, I can't really say on implant courses. I mean, like I do implant work myself. And when I started doing, I was initially like, okay, I have to do a course because there's like no other way I can start doing implants. Like I have to do a course to do it. But luckily where I'm working now, I've got a mentor who's helping me do all my cases. He's a specialist oral surgeon, and he's been doing implants for like 30 odd years. So he's really helping me with my learning. And I feel like having that mentor really helps. That's a whole other thing to talk about, mentorship. Yeah, I mean, courses abroad. So I was looking at, all the different types of implant courses that I could do, whether it's a diploma here or abroad or a master's or whatever. It can get quite sort of overwhelming to the point where I actually decided, okay, I don't want to do a course at the moment. I would just want to build on my practical skills because that's what ultimately you learn when you've got a mentor in practice. You've got a patient, you've got a case, you're learning case by case. Whereas some of these courses can be mainly theory based. But I know a lot of these sort of international implant courses, you go to Brazil or Egypt or India and you place like 10 or 15 implants. And then, yeah, you build your practical skills in that way as well.
Tell us more about this, mentorship. Like, did you get into it? How, like, for example, I'm interested to kind of basically do what you're doing,
Yeah. Okay.
T2.
Yeah.
How do we go about getting into that realm?
Yeah, yeah, everyone asks me this question, but I kind of just sort of fell into it. So after as I was finishing DCT2 and applying for an associate role, I was literally just looking for anything that was out there. I wasn't specifically thinking, I mean, I knew I wanted to do more oral surgery work. I knew I wanted to do implants, but I wasn't thinking, okay, I need to find a practice where there is a mentor. I just, happened to find a vacancy in the practice that I'm working at. And my practice principal happened to be a specialist oral surgeon who, does implants and who mentors his associates. So I feel like I was quite sort of lucky to get into that sort of role that I really wanted. But yeah, no, mentorship is so, so important, just someone there to, guide you through it. Because implants is something you don't learn at all at university. I think there was like one day in uni where we learned how to take like impressions for implants, but that was literally it. It's just really important to have that person to guide you. So my mentor, like I can message him about any sort of case that I get through the door, and just, really just ask him, okay, what am I doing for this case? Step by step, he'll help me treatment plan, be there during the surgery, be there during the restorative phase, be there, to be able to answer any questions. So yeah, no, it's been going really good so far. I did my first all on full case yesterday.
But were you nervous, or did you feel like, were you quite nervous for it?
Yeah, because it was the first all on four, I was quite nervous. My mentor was there. So the previous cases that I've done have been, either a single tooth or, a couple of teeth, like a bridge or whatever. Obviously, during my first case, he was there scrubbed in, helping me place the implants. But after that, it kind of, you sort of pick up on how to do it. And he's there in the background, but not really getting into the surgery. He's just sort of letting me do it myself. But yesterday, all on four, I was quite nervous but really excited for it because it was like the first big case. More excited for the patient because I could see her journey through her having really, really bad teeth. She had retained roots everywhere. So had to extract everything. She was in a denture. And then yesterday we got to the point where, we could fix that denture as a temporary on her implants and she'll come back for the final restoration later. But it's just going through that patient journey and seeing that happiness that it can bring to a patient. I think that's ultimately what it is. I mean, like I said before, like for me, I wanted to become an orthodontist initially because I wanted to make patients happy. But then I realized I really enjoyed surgery. And I feel like implants just brings that together. It's surgery, but also giving people back that smile and confidence that they've lost. So yeah, that's ultimately why I love doing that. So yeah, no, it's good. Yeah.
So for implants, like there's a lot of people. So I've spoken to a few people about this, like whether they'd go into implants, and some I know it's like a very booming industry right now, but I think there's also concerns about the whole legal aspect of it.
Mhm.
So what would be your take on that?
Legal aspect, as in,
As in, like, there's a lot of implantologists who get sued, and there's more legislation involved apparently.
so
Like compared
legally,
to just a dentist, like you're taking on more riskier works.
yeah, it is more riskier work. I mean, it's with anything, you need to develop your skills. Getting sued in implant dentistry, I mean, you can get sued in general dentistry, you know, and it's all about building that patient trust. That communication is so important. And yeah, just being able to develop your skills as well. And like right now, for me, I'm so early in my implant pathway, hence why my mentor is so important to me and so useful to guide me through everything and making sure that, any sort of errors can be minimized. Like I would never do any sort of case on my own without his help. And like at the moment, I don't have, an implant qualification as such. Like I don't have a master's in implants or a diploma in implants. I'm working towards it. But at the moment I don't. So like I wouldn't go ahead and, just do it any sort of implant case on my own without telling my mentor, all of that. So yeah, it's really like how you take it and how you want to do it and minimize your risks.
And then so does your mentor many people, or is it just you? Like how does
Yeah, so he's mentored a lot of people in the past. Right now, he's sort of at that stage where he's not doing much clinical work himself. He's our practice principal, but he's not working every day. He's, mainly sort of lecturing abroad or here or, doing conferences and things. So, which is quite nice because he's got some time to come and help me when I've got a case. I just text him like, okay, we've got this case, surgery's booked on this day. And he'll be like, yeah, I'll pop in, I'll come and help you. That's fine. So yeah, it just works quite nicely. Yeah, because I know it can be quite hard to find a mentor, especially if you don't have a person within the practice that you're working in. It can be hard to, try and find a mentor in a different practice or someone who is currently working, let's say 4 or 5 days a week. They're busy doing their own work. So where do they have the time to come and sort of help you? Yeah, it can be quite tricky to find a mentor, but there's someone is looking for an implant mentor. I would suggest going to, organizations like the ADI or the ITI. And they're, people, when you go to conferences and things, you network, you find people who can potentially help you. And they've got a list of people who are available as mentors who've got that time to come and help you. So, yeah.
Like, are you working full time?
So I work 4 days in
Full.
one practice. Yeah, I don't work on Wednesdays. So I get like that little break in the middle of the week, which is nice. Again, important for work-life balance.
Yeah.
I mean, like when I got this role, they offered me 4 days.
Mhm.
And I was like, okay, fine. I didn't really think to use that day to go, work in a different practice or anything. I just thought, okay, well, you know what? Let me have that day off. It's been helpful because initially I was wedding planning on that day. And now I use that day to do my restorative course. And, you do need that extra day to, do extra work or reading or, life admin or whatever. Yeah.
Then I guess it doesn't feel like a working week either. It feels like 2 days, mini
Yeah.
weekend, 2
Right.
days, weekend. So it's like
Yeah.
nice and split
It's
up.
nice. Yeah.
Shall we wrap up? Yeah.
So I'm assuming
Right.
you've got a day off tomorrow then, right?
I do have a day off tomorrow.
Nice, nice, nice. Have you got any plans for tomorrow?
Yeah, so my cousin just gave birth last
Wow.
week. Last week, yeah. So she usually lives a bit far away, but she's come to her mum's house, which is quite close by here. So I can get to see. Well, I saw the baby last weekend, but I can see the baby again tomorry. So I'm excited for that. Yeah, the first baby in
Oh,
the
happy
family. So
duties.
yeah, it's exciting.
Oh.
I'm assuming you guys are working uni. Yeah.
Yeah. Hey, what about you, lectures?
Lectures are happening. If I'm attending is the question.
Lectures are you having?
I think it was, well, not me. I'm not having them. They're
Oh my gosh,
happening.
no pre-reading. What is this behavior?
I usually pre-read. I only pre-read if I
Gosh, I
attend.
never did that. I
Oh,
never
really?
did. God.
It's fixed pros, so yeah, partial crowns, full crowns.
Yeah.
Something like it's
Something
fine.
like it's,
I'd deal with it
something
at
to do with
exam time.
dentistry.
I'd deal with it at exam time, right?
Sure.
You
I mean, I
will.
will.
You'll have to deal with it.
I have to. That and all the other lectures from last year as well,
Yeah.
from before Christmas.
Oh dear.
But I love Thursdays though. Like I love clinic days.
Mm,
Like
That's good.
lectures, honestly, I hate them because like when it comes to like Anki and stuff like that,
gosh.
that's a nightmare app for me. It's like if
I,
I could burn anything, I'd be burning Anki. Like
What's Anki?
flashcards back in
we
your
use.
day.
Yeah.
Did you use Quizlet, Amy?
No.
She used pen and paper.
Yeah, right.
It's just like a flashcard app, basically.
Right. Okay. That's quite cool. Yeah, we never had that. Yeah, it was literally pen and paper and
Yeah,
textbooks and yeah,
textbooks is mental.
yeah.
Yeah, no ChatGPT.
No chat GPT back then. Life is so easy for you guys now.
Do
I'm
you use
just
it now?
thinking, if we did our degrees with ChatGPT,
Yeah. Oh my god.
like how life would have been,
Yeah.
like much easier.
But they're on
Much
it though,
easier.
because they start analyzing because they've got all these like
Yeah.
how plagiarism checkers have got AI checkers
Mm,
now, so it's like can't get away with it that easily. But
Yeah.
no,
Yeah.
planning
you can
essays
still
and stuff
use
is
it.
really helpful.
You can still use it as a tool to revise from. Like,
Yeah,
you'd be like, oh, can you make me like 50 questions on this topic? Like, at
Yeah.
least it can help you somewhere. Whereas for
yeah.
us, we kind of just had to like look at the lecture slides, like, right, I'll make a question out of that.
Exactly. Yeah.
That's why you guys will be better dentists than us.
I don't know about that.
It's like I think it was what was it like all the memes about like COVID year doctors and stuff that graduated during COVID.
Yeah.
Yeah, where everyone's gonna die. Yeah, but as in yeah, with lectures, for some reason I just can't retain information. But when it comes to
Mhm.
like interacting with patients, that's what I really love.
Yeah.
That's always been my go-to.
Are your lectures recorded?
Yes, they are.
Okay.
But QM is notoriously bad at actually assigning it to the right place. So they're recorded, but somewhere,
But somewhere on the
somewhere in
internet.
the abyss. Yeah.
Yeah. Because if I
Yeah.
didn't go to my lecture, I'll just, I know the recording's there and I can like rewind it. So if I've missed something, then you can always go back and, yeah. Whereas when you're actually sat in a lecture, if you just zone out for a couple minutes, then that's it. You're just lost.
You're just screwed.
Especially with like
Especially, like,
dental
first year.
materials.
Dental materials was worst. I absolutely hate that.
Most of that, you don't use that knowledge in
Uh,
practice. At least from my experience. Because you
I
get,
mean,
like,
now it's quite interesting actually. Now that I'm doing that restorative course and learning about dental materials again, and like is actually so important to understand your
Mhm.
materials, because you're using it, day in, day out when you're doing restorative work. So you need to know what you're using. You need to, understand each material. And it becomes more interesting actually when you use it more and you understand it more. In uni, you're just bombarded with, yeah, all of that. And you're like, oh my goodness. But then when you're actually doing it in practice, and then you're like, oh, okay, fine. It makes sense. It makes a lot more sense in practice.
yeah. And then it's like when we're doing dentures, I was like, I swear I don't even do this stuff. It's like, when they're like constructing the dentures, all that kind of stuff. I was like, I'll probably send it off to a lab. I'm not going to be doing this.
Yeah, even like
Yeah.
denture design, I'm sometimes like, I draw like a little design and I'm like asking the lab technician, do you think this is fine? Or would you like change it? What would you add?
But I guess like you need to know it. I guess if you're like trying to run your own business, or like you need to know like, all the back end stuff, right?
Oh, yeah.
Yeah. 'Cause otherwise, I'm sure if you didn't, the lab techs would like rinse you.
Yeah.
Yeah.
You need to learn how to actually appreciate all of that. Like, at the
Yeah.
Yeah.
time of uni, you're like, oh my God, like, why am I doing this lab session? Like, in the grand scheme of things, like, if you're like an associate, sometimes you'd want to go and actually visit the lab yourself, or
Mm,
like know a lab technician so that you guys are on the same page, and then you get a better outcome for the patient. So like
yeah,
it does make sense in the long term, but like
it
at uni,
does.
why am I doing this?
Yeah.
Yeah. But then again, like you guys said, I'm probably not going to remember it. It's 30%, right? And then all of the 70% comes from actual
Actual clinical work.
actual clinical work. But I do feel like as soon as I step out as a doctor, I'm just going to be like, I've no clue what I'm doing. I'm so cooked in real life.
To be
It feels.
honest, a lot of people, graduates, do feel like that.
But you learn a lot in FD. You
You do.
definitely do, Yeah, because you're literally working, but it's, you've got a supervisor who can help you. But yeah, you learn a lot in FD.
And it's about making the most out of FD.
Definitely, you got to make the most out of it.
Because like at the end of the day,
Do everything.
yeah,
Yeah.
you're paid a fixed salary. So it's not like you're paid
Mm,
like make sure even like challenging cases,
mm,
talk to the advisor, but like just have a go. Because
yeah.
you're kind of like, unless you're lucky that if you have a mentor after FD, but not everyone has that.
Mm.
So just go for it during FD.
So UDOs don't really exist in your foundation yet.
It does.
It does. Like you have to do a certain amount of UDAs to pass your FD year.
Okay.
But like, I mean, money wise, it doesn't count because you're on a fixed salary.
Yeah.
So
Right,
yeah,
okay.
just do everything. If it's a surgical extraction or a post and core or whatever, a tricky root canal. Yeah, I mean, I actually got told off by my ES for doing an RCT on an upper 7. Like I wanted to do it, and he was there like, oh, if it's an upper second molar, it's out of your scope of practice. You need to refer. And I was like, but I just wanted to try and do it.
Yeah.
So what? So if you shouldn't do it now, then you're never gonna do it. So
Yeah, and
of
I
all
was
the
like, oh, I want
tangents,
to
that
try and
should
do
be
it. And
fun, right?
actually, it
Yeah.
was fine in the end. I actually did a pretty good job out of it. And he was kind of like, okay, fine.
All right. Thank you everyone for listening. Thank you, Dr. Aimee, for coming onto the podcast.
That's all
Is
right.
there anywhere where we can find you on Instagram? Have you got like a public page?
Yeah, sure. It's at dentist.a.
Fantastic. All right. So thank you everyone for listening, and we'll see you soon.